Welcome. And thank you in advance for your completion of the Horizons Hospice facility annual orientation. Here is our contact information. Please call the office with any changes in conditions or any patient needs. We are available 24 hours a day, 7 days a week. Agenda: Hospice philosophy, admission process, hospice team, patient rights, facility responsibility, hospice facility coordination of care, documentation and forms, pain management, discharge. Additional items to review: infection control policies and CDC hand washing requirements. Gone from my site. And sample chart. Hospice philosophy. Hospice affirms life. Hospice exists to provide support and care for persons in the last phases of a life-limited illness so that they may live as fully and comfortably as possible. Hospice exists in the belief that through appropriate care and the promotion of a caring community, patients and families, caregivers will be free to attain a degree of mental preparation for death that is satisfying to them.
Hi, my name is Emma, and yes, you are correct, I'm from England. I will take you through the admissions process. Horizons is able to provide hospice care to residents of the nursing facility in the same way that a hospice provides care to patients in their homes. The policies and procedures which serve to guide care in the patient's own home also serve as guidelines to those patients residing in extended care facilities under home care. The admission process begins when a referral is made by any one of several sources: the physician, hospital or nursing facility personnel, Horizons personnel, a family or friend, and/or he patient. Once the referral is received, the attending physician is contacted to confirm the prognosis of less than 6 months to live and approve the patient's admission to Horizons Hospice. An Horizons staff member will meet with the patient and family or significant other to discuss thoroughly the hospice benefit and to complete consent and other admission forms. The nursing facility is encouraged to have a staff member present at the time of the admission. The Horizons RN will complete a thorough assessment within 24 hours of the admission to Horizons Hospice services, followed by a conversation with the designated charge nurse on the unit to review assessment findings and establish a plan of care that is mutually agreed upon and follows a hospice approach to palliative care. Medications, durable medical equipment and supplies not covered in the normal room and board fee, and needed due to the terminal illness, will be supplied by Horizons and delivered on a routine basis according to usage and need. Because Horizons is financially responsible for any care related to the terminal illness, we ask the staff to call Horizons if there is any need for a change in the plan of care or additional drugs, equipment or supplies. A copy of all Horizons admission paperwork, assessment and ongoing notes by team members will be kept in the back of the patient's chart under a hospice divider provided by Horizons. Physician orders will be obtained by the facility RN after a discussion with the Horizons RN case manager. All follow-up routine visits will be arranged according to the plan of care. Below are examples of other disciplines' plan of care. Horizons Hospice interdisciplinary team members at a minimum include the following: physician, registered nurse, social worker, pastoral or other counselor. Additional members may include physical therapist, occupational therapist, speech therapist, registered dietitian, pharmacist, home care aide, homemaker, and last but not least a volunteer. The interdisciplinary team is responsible for many tasks including but not limited to participation in the establishment of the plan of care for each patient admitted to the hospice services. The team members also participate in the periodic review and updating of the plan of care for each patient receiving services. A hospice patient has the right to be informed of his or her rights, and the hospice must protect and encourage using these rights. Hospice patient rights are a list of rights guaranteed to all hospice patients, including what a hospice must provide to a person who is receiving hospice care. You can find hospice patient rights in your facility's Medicare and Medicaid service policy manuals. The Medicare conditions of participation are issued as regulations set by the federal government agency, the Centers for Medicare and Medicaid Services. Hospices must follow these regulations, which include a section on patient rights. Below is a list of patient rights. For a more detailed list including patient responsibilities, please refer to your Medicare and Medicaid policy manuals. Nursing facility staff are responsible for the following: 24-hour-a-day room and board and activities of daily living. ADL care remains the responsibility of the nursing facility staff. All policies and procedures of the nursing facility must be maintained by its staff. Routine or special labs and/or tests must be approved by the Horizons RN before obtaining orders from the physician or administering/obtaining from the patient. All medications, equipment, supplies needed due to the terminal diagnosis must be approved and/or obtained from Horizons prior to supplying. The nursing facility staff's documentation must reflect a collaborative effort in coordinating and implementing the plan of care for the Horizons patient. Therefore, documentation must state who, what for and when the Horizons team member was consulted and outcome to the hospice plan of care. The nursing facility also has a responsibility to identify appropriate patients for hospice care. To assist the staff in identifying those patients in the nursing home who may benefit from hospice services, the patient may have any of the following diseases: end-stage cardiovascular disease, end-stage heart and lung disease, CHF, COPD, cancer, AIDS, end-stage renal disease, and even end-stage Alzheimer's disease, to name a few. There are also signs and symptoms to look for when identifying possible hospice patients: progressive weight loss, profound weakness, fatigue, progressive decline in health in spite of medical therapies, increased edema, increased pain, difficulty breathing. Once a patient is identified, the nursing facility RN may contact the patient's attending physician for an approval, after discussion with facility liaison for an order to consult Horizons. The physician must feel the patient has a probable prognosis of 6 months or less. The skilled nursing team and hospice team both provide an invaluable service to patients and families faced with life-limiting illness. Coming together in an integrated manner, caregivers assure optimum care and services, providing for the quality of life at the end of life that both entities so heartedly embrace. The skilled nursing facility staff and the hospice team shall communicate, establish and agree upon a collaborative, interdisciplinary care plan for both providers which reflects measurable objectives and timelines to meet a resident's medical, nursing, physical, psychosocial, and spiritual needs, as well as the needs of the resident's family, caregivers, as identified in a comprehensive assessment. Horizons Hospice and the facility will jointly do the following when implementing the coordination of care. Assure, via mutually agreed upon method, that care plans are integrated and congruent with one another in relation to consistent problems identified with designated interventions and palliative goals that clearly delineate disciplines responsible for those interventions and follow-up communicated. Create and maintain a mutually acceptable communication system, which includes the established conference, that maximizes the flow of information for enhanced care delivery. Periodic assessment and review of care plans by both teams to ensure that the rapidly changing needs of the patient, family facing life-limiting illness are met. Both will jointly participate in orientation and continuing education to ensure that the clinical caregivers are aware of and are guided by the integrated plan of care. Both will be knowledgeable of the hospice patient's medical plan of care.
Hi, my name is Eric, and I will guide you through the next portion of this training. Hang in there, we're almost done. Every Horizons Hospice patient has a 3-ring hospice binder, which is usually located in the nurse's station in most facilities. This binder allows us to maintain a clinical record for every individual receiving care services. Inside the binder you can locate admission, administration information, advance directives, physician orders, assessments, updated care plans, nurses' notes, home care aid notes, rehab, therapy notes, social services, education and treatment, lab and special reports, pastoral services notes, and volunteers log. It's also important to know that every Horizons Hospice team member who visits the patient will sign in on the patient log located in the front of the binder. Team members will also document the summary of their visit. Facility contracts will also be located in the patient file, which may be needed for your facility annual inspection. Hospice staff members and skilled nursing facility staff members are a collaborative team working together to provide the best possible treatment of a resident's pain and symptoms, so that his or her days may be spent as comfortably as possible and allow for a dying with peace and dignity. Therefore, communication regarding treatment for hospice residents' pain and symptoms needs to be opened so that both staffs feel committed to the above goal. This is of utmost importance, particularly when the resident has been cared for by the skilled nursing facility staff for many years. The transition from restorative treatment to palliative treatment can often be difficult, so the team needs to work together with compassion and sensitivity. There are two types of discharges. The first is when the patient dies. When this type of discharge occurs, the facility should do the following: notify Horizons of the death, notify physician, family and funeral home of the death, provide post-mortem care as stated in the Policy and Procedure Manual, request an Horizons team member's presence when appropriate, follow up with the Horizons RN if any issues or concerns surrounding the death, refer any family member in need to the Horizons Bereavement Coordinator. Controlled and other prescription medications no longer needed by the patient will be disposed of in compliance with agency procedure, which will meet the requirements of all local, state, and federal laws. The second type of discharge is non-death related. This can occur for a number of different reasons. When this type of discharge occurs, Horizons Hospice will do the following. Horizons will discuss with nursing home administration that the patient will be discharged from Horizons Hospice and give reason for discharge. Medications/supplies will be left with patient if they are unused. DME payment will no longer be Horizons Hospice's responsibility. We will try to provide resources in the community to help with DME, if necessary. Horizons Hospice will review medications with the caregiver and discuss the discharge with the attending physician. Lastly, Horizons Hospice will notify family, on date of discharge, the patient is no longer on Horizons Hospice services. During discharge, communication is very important. We want to make sure that the discharge plan is followed. Every facility will be provided with Horizons Hospice Standard Precautions Policy. The purpose of the material covered in the first half is to reduce the risk of exposure to and transmission of infections when caring for patients. All Horizons staff and patients are provided with this information and receive ongoing education on the importance of infection control. The Standard Precautions Policy highlights the following bullets located on the slide. The video you will see demonstrates how easy transmission of infections can occur, especially in a facility. The policy manual provided also has a section on hand hygiene. The purpose is to prevent cross-contamination and home care-acquired infections. Please be familiar with the information in the policy, for it is very important for your patient's health and to protect yourself. The last video demonstrates the CDC-approved hand washing technique.
Hi, we are wrapping up this orientation, but first I must introduce to you, Gone From My Sight. It's a short pamphlet that helps many people understand the uniqueness of the dying experience. It provides the readers with a guideline, a roadmap of what many people may experience months, weeks, days, hours, and minutes before death. Many of the patients' caregivers have told us that this book really helped them understand what their loved one may be experiencing and what may be expected. If any of your staff would like a copy of this pamphlet, we will be more than happy to provide that to you. This concludes your facility annual orientation, provided by Horizons Hospice. We appreciate the time you spent reviewing this orientation video and the provided policy manual. Please don't hesitate to contact us if you have any questions. We are always here to help.